I'm Dr. Sinead Murphy. I'm a consultant neurologist in Tala Hospital. So Huntington's disease is a genetic neurodegenerative condition. It's autosomal dominant, which means that if a person is affected with Huntington's disease, if they have children, each child has a 50-50 chance of inheriting it also. It causes a triad of symptoms. There's a motor component, a cognitive component, and a psychiatric component. So in terms of the motor symptoms, the common or typical features would be of choreiform movements. So these are involuntary, rapid movements of the extremities, usually the arms and legs, but as things progress, they can involve the trunk or the face and the neck. It can affect the speech and swallow, so articulation and the processing and the coordination of speech and swallow is impaired. It affects the balance and dexterity, so fine motor skills can be difficult and people can be prone to falling, and as time progresses they may need walking aids like frames or rollators, and in later stages maybe wheelchair. The cognitive symptoms are variable as well, but I suppose the common thing is a dysexecutive syndrome. So this is where someone has difficulty processing complex information, difficulty with planning. If you have to make a cup of tea, normally your brain would process that information and make a plan pretty quickly, but someone with Huntington's would find that quite difficult, potentially. Difficulty with their awareness of their own deficits. So this would be a common problem, that people would have significant deficits in planning and maybe in impulse control and judgment, but they wouldn't recognise those impairments themselves. So when people would point out to them that they have an issue, they wouldn't understand it, they wouldn't appreciate it, and that can cause a lot of conflict. The GP is very important in the care of a person with Huntington's, because they are likely to be caring for that person for 10 or 20 years. And in a lot of cases will also be caring for other members of the family, like the spouse or the children. And there is a lot of burden on caregivers of people with Huntington's disease, and that impacts on the care of the individual who's affected. Other members of the multidisciplinary team would be occupational therapists and social workers. The public health nurse is very important for people in the community. And in specific terms of the cognitive and behavioural aspects, I think a lot of that boils down to education of caregivers. So because of the dysexecutive problems, the patients themselves often are unaware of their own deficits and limitations. Yeah, so I think early referral is really important for people with any chronic neurological condition. For one thing, for some of these services there are long waiting lists, so that makes it even more important to get an early referral in. But for the allied health professionals like physiotherapists, occupational therapists, speech and language therapists, dietitians, early referral is really important to get someone before they're started to fall, before they start to lose their voice, to try and intervene before that point, so that you can help that all of those things improve quality of life immensely. Same thing with all of the relevant healthcare professionals. Unfortunately, we have very long waiting lists in neurology because there are relatively small numbers of consultants. So often, unfortunately, people may be waiting a long time before they're seen by a neurologist, but that doesn't prevent a GP making referrals to people in the community like physiotherapists or occupational therapists, or referring to a psychiatrist if there are psychiatric symptoms, because those things can be dealt with and are usually easier dealt with if people are seen early. Think Huntington's, think physical, think behavioural, think cognitive.
Well, my name is Sean Lennon. I'm 26 years old and I am the youngest of 3 children. I found out about ADHD when I was roughly 8 years old. We found out because my grandmother on my father's side, who had the condition, she was improperly diagnosed as having Alzheimer's. So for many years we actually didn't know that ADHD was in our family at all. It was only when she was properly diagnosed, my father was then let know about it, and then my parents started to tell us. It's a very hard question to answer because it's, I suppose you could say it's a mix of all neurological illnesses. It takes certain aspects from each one. But the thing is, what's unique about Huntington's, it affects every single person differently. So there really is absolutely no way of telling how it will affect a person, which is actually one of the hardest ways of treating the condition or even trying to explain it to people, because really the only way you could properly describe it is to live with it on a daily basis, because you really don't know what will happen from day to day with a different person and how the onset will affect them. The services I'd be most familiar with would be the ones by the HD Association of Ireland. Such things as just having a family support officer that you could talk to, or the way that HD Association Help brings quite a lot of families together, particularly the annual meetings. This has proved to be an absolutely brilliant service, purely because when you're dealing with HD, it can often feel quite isolating because it's quite a rare condition. And so just to meet other people who are going through the same circumstances, the same ordeal, it's been tremendously helpful as giving a sense of community and just emotional support. If you're having a bad day, you know there's other people out there you can talk to that'll help you through these tough times. When I went for my test to find out if I had Huntington's or not, coming up to that point, I met with psychologists and neurologists who explained the finer aspects of the condition and explained to me sort of the emotional aspects of whether or not you would have it or not have it. But then after that, a nurse walked into the room, put a piece of paper on the table and said, "It's good news," and she walked out. That was it. Nothing came after that. Now, most people would say, well, you don't have the condition, you should be over the moon, but what they don't understand is it doesn't matter if you have the condition or not. HD is for life. As I said, I'm the youngest of 3 siblings. So what if my siblings were to test positive? How exactly can I reconcile myself not having it to them having it? It's such a unique condition that affects everyone so differently. You need help to come to terms with these things, whether you have the condition, whether you don't have the condition, and just the long-term effect of living with it for your entire life. My best advice would be speak to your family. Talk to them, let them know how you're feeling. They can help you through it, because at the end of the day, I now have an extremely tight-knit, close family because we had to struggle through all these adversities together. And so I would say stick to your family. Support each other, take care of each other, because you're the best friends you will ever have. And if you can just stay strong together, nothing can stop you.